welcome everybody. We're going to keep admitting folks in here, and I'm going to go ahead and get started. My name is Amy Dawson, and I'm with Word Circle Strategies. We are in support of NAC and helping run this meeting. And I'm actually going to spend the first 5 minutes with you guys before you hear from the leadership and we get into the meat of the meeting. So let's go ahead and get started here. Want to know what to expect. I want you to know what to expect today from a process and technical standpoint. Here are a few things that you can prepare for. First of all, like I said, this meeting is exclusively designed to be an engaging forum. This is not a briefing at. We really hope you came to offer in and participate in this process. So as part of that, we want you to be able to know how to ask questions. And everybody go ahead, if you're not on mute, go ahead and put yourself on mute. I'm gonna actually, there we go, everybody. Go ahead and put yourselves on mute. And we may keep doing that throughout the meeting. Let's see. So questions. Throughout the meeting today, there's going to be a lot of opportunity for you to ask questions. The way that we really want you all to engage with questions is to raise your hand virtually. And I'm going to walk through in the next slide how to do that if you're not familiar with how to raise your hand in Zoom. Just to give you an idea, this is what it looks like. There's my hand. But we will walk through how to do that in just a minute. So that's the primary way that we hope that you all will choose to engage. You can raise your hand at any time, and essentially you'll get in line to ask your question. And me as the moderator or one of my colleagues will be able to call on you, and we'll let you know when it's your opportunity to take yourself off mute and ask your question. You can also submit questions in the chat. It won't be looked at as scrupulously. We'd rather have your engagement, but certainly feel free to put it in the chat, especially if you're having trouble with your audio or something like that. And Gina and Dick will both take the time to respond in any form that your question comes in. Okay, so that's questions. That's how to engage with questions. Attendance. We want to know that you're here. So what we're going to have you do is rename yourself on your screen to your first name, your last name, and the name of your health center. And I'm going to walk through in the next slide how to do that if you don't already know. But we definitely want to know that you're here. And by renaming, I mean your screen name. So if you mouse over your screen, you'll see sort of either an acronym or a part of your name or something, a screen name. But we'll walk through how to change that. But we want to know you're here. So if you already know how to do that, please go ahead and change your name on the screen to your first name, last name, and the name of your health center. If you're in a room with a bunch of people at a health center, just put in the name of the health center and say team or group, and that'll be fine too. Okay, next thing, polling. Throughout the session today, we're going to have some polling questions pop up. This is to get your engagement and feedback on a few things. So we're going to walk through how to do that in the next slide as well. We are recording the session with the opportunity for folks to review it. They can access it on the NAC Health Center Resource Clearinghouse page once that it gets edited down to an appropriate size and placed on the website. So this is being recorded and it will be placed for others to be able to review. And then finally here, just announcement wise, before we do a tech practice, at the end of the session, we want you to stick around for just one more minute at the end to fill out an evaluation of this particular meeting. It would be really helpful to NAC and make sure that we're doing this right for you. That's the announcements. Moving on to the next slide, please. Okay, first of all, I want everybody to get practiced here real quick. We're just going to run through a few pieces of functionality with Zoom. Go ahead and use the chat box and say hi to everybody. Make sure you know how to find chat. If you're new to Zoom, mouse over your screen at any time to see a toolbar pop up. Mouse up on the screen to see a toolbar. There you go. So I see Michael. I see Sue. I see Susan. I see Kelly. I see Eva. I see Jen O'Donnell. I see all kinds of people. This is great. Thank you all for using the chat. Again, if you don't know how to do that, just mouse over your screen. You'll see a toolbar at the bottom. It typically is, and there's the chat. Let me just pause there and see if anyone is having trouble with the chat. You can raise your hand or take yourself off mute and ask the question. Okay, I'm going to go ahead and move on. So your video. Same thing, mouse over your screen, and on the toolbar you see stop video, start video. We'd love for you to start your video. So click start video if you haven't already, so we can see your face. That would be really nice, especially if you're asking questions. You know where your mute button is? I'm just going to take that for granted. So let's talk about raising your hand. Okay, if you want to get in line to ask a live question, which we highly encourage, what I want you to do is mouse over your screen and look for your Zoom toolbar again with all those things on the bottom, mute and all that. And there is a reactions tab. You can see it on my number 4 here. You see the reactions button. That's what it looks like on your toolbar. And when you click on reactions, you get all those little fun emojis. And then the solid bottom bar there says raise hand. So everybody go ahead and practice that. I want to see your hands get raised. Let's raise your hands. Awesome. Awesome. Raise your hands. I see 12 hands. I see a thumbs up. So thumbs up. One thing about thumbs up, if you don't mean to do thumbs up, one thing to know is that it'll just disappear and I won't be able to see you for very long. So thumbs up doesn't stay. The hand raise stays. I got 17 people raising their hands. Awesome. Go ahead and raise your hands. And then you also click the same button to lower your hand. We can lower it for you after you ask your question, but if you want to take yourself out of line, then go ahead and lower it. I see someone clapped. Maybe they were clapping for me. Thank you very much. But if you weren't clapping, make sure that you find the icon that's raise hand. So it's funny because you see all the little cute icons with the hands, but then there's the one that below all those little images that says raise hand. Hi, do I have a question from someone? Okay, let's go to rename yourself. All right, so how to rename yourself. What we're going to do is you'll see on my number 5 here, it shows you what you do. You can click on the participants tab. Again, mouse over your Zoom screen and you see participants. Click on participants and then you will see your name there. And when you click on more, you see an option to rename yourself. And once you click on that option, you can type anything in. There's another way to rename yourself. So if you didn't follow that, you can listen to this. Find where your face is, your video on the screen, where your face is, and scroll over your video, mouse over your video, and a mute button and 3 little dots will come up. 3 little dots if you mouse over your video screen. And when you click on those 3 dots, a menu comes down and it gives you an option to rename yourself. Please try to put your first name, last name, and health center. If you haven't figured out how to rename yourself throughout the session, don't panic. We'd rather you listen to the session and engage in it. Rahul, our tech support team, will write to you in the chat and help you out. And speaking of that, once prompted, well, actually, so the last one here is about finding tech help. So Rahul is our tech support team. He's in the chat. You can write in the chat. You can write directly to him, tech help Rahul, and get some help. So I want to also do one last thing, and then we got to move on because this is not the meat of the session, but just one last thing. We're going to test out the polling function. So because a lot of what we're going to be doing today is getting your feedback through polls, let's give it a whirl here. So right now, you should have seen something pop up on your screen, and it's a practice poll. And this is for you to get an opportunity to figure out what it's going to look like and how to respond. So let's go ahead and respond to this. By the way, there's some options below. You can scroll down. Sometimes the whole thing doesn't show up. Want to make sure everybody feels comfortable finding the poll questions and responding. Looks like we've got 25 people that have responded. If some of you are hunting for where this polling question is popping up, look at your Zoom toolbar and see if you have anything that shows an indicator like a red dot or something that looks like it needs to be clicked. Click on it and see if it's hiding. Sometimes the practice or the poll function hides. Okay, we got 33 people out of 47. I think we've got almost everybody. And I'm going to end this poll in 1 second. And then what's going to happen here is you should be able to see the results. Here we go. So it looks like coffee is the preferred choice here. So, and in the session, when we have people click on other, we're going to offer the opportunity for you to pipe in and give us some explanation about what that other is. I'm going to stop here, folks, and I'm going to be quiet for 30 seconds and see if there's anybody who would like to take themselves off mute and or raise their hand and ask me a question about any of this before we get started. I see Rich and Lonnie, you've had your hands up. I'm wondering if you have actual questions or you just want to lower them up. They're going down here. Anybody have questions? When in doubt, use the chat. Okay, folks, I'm done. Next slide, please, and we will get started with the program.
Yeah.
Okay. Well, hi, everybody. And I'd like to ask you if you could go on mute while we're proceeding here with the meat of today's call. Amy, thanks for all that great technical orientation. And it is so wonderful to see many, many familiar faces and names here. My name is Gina Capra, Senior Vice President for Training and Technical Assistance, and the proud daughter, granddaughter, niece, and cousin of military veterans. Thank you for making the time to join today's Veterans Interest Group meeting sponsored by the National Association of Community Health Centers. Next slide, please. NACHC Veterans Interest Group is a way that NACHC brings together people who are really interested in discussing ways to improve access to care and services for our military veterans, many of whom are health center patients, staff, and board members. For the veterans on today's call, thank you for your service in uniform. And thank you for your continued service in the fight now to improve access to high-quality, community-based healthcare services. The Veterans Interest Group began over 5 years ago as an informal meeting at NACHC conferences, specifically the Policy and Issues Forum in Washington, D.C., where we have access to officials from the U.S. Department of Veterans Affairs. We then began meeting at NACHC's Summer Community Health Institute, where we provided educational sessions on veterans-related topics such as employing veterans at health centers, coordinating with the VA, or understanding the complexities for health centers seeking to become VA-approved community providers through what was then called the Choice Program and has since evolved into the Community Care Network. Since the onset of the pandemic in 2020, the Veterans Interest Group has sustained momentum through newsletter updates from NACHC several times a year, as well as through national education webinars on topics like screening for veteran status and developing veterans liaison positions in health centers. Today marks our first ever all virtual Veterans Interest Group office hour. We are thrilled that so many of you have joined today's call, and we hope the time together is informing and invigorating. Today's agenda includes some National Veteran Program updates from NACHC's Senior Advisor Dick Bohr, also retired U.S. Public Health Service, and a preview of some technical assistance products on which we hope to get your feedback. NACHC is pleased to be working with Ward Circle Strategies, a local consulting group here in the DC area with many years of experience working directly with the VA, the Department of Defense, and health centers. So let's get started. Over to you, Dick Bohr, for some national updates.
Thanks, Gina. And I can only second what Gina said about, seeing the names and some of the faces. Okay. Been way too long for, in some cases. So good to have you with us today. I'm going to try to touch on 4 things. I'm going to talk about the Community Care Network, what's going on with that. I'm actually going to flip the order. I'm going to talk about some, what's going on with the budget and the congressional process. Then I'm going to focus on, kind of the whole area of oral health. And then I'll end with the work that's underway, looking at veteran health facilities across the country and where to go with that. So with the Community Care Network, again, the bottom line with Community Care Network, is today it is still the only pathway for community providers like health centers, to provide essential services, to a veteran, with the potential, of there being a payment or reimbursement, again, assuming that man or woman is not otherwise publicly or privately insured. When the Mission Act, was passed by Congress and signed into law, it moved the Community Care Network to a slightly different arrangement than it started out with Choice. In essence, the idea was to create preferred provider networks, in and around all of the VA medical centers. networks, okay, that health centers as well as other community providers could participate in. There were 2 third-party administrators, okay, Optum serving about half the country, disproportionately, to the east of the Mississippi, and then Tri-West serving, the other parts of the country, not just west of the Mississippi, but mostly west of the Mississippi. Remember, the actions that many of you have already taken and continue to be relevant, okay, is you've got to be dealing, okay, with 2 groups. You've got to be working with the third-party administrator, okay, for your state, for your region of the country, but you've also got to be working with the VA Medical Center or CBOC, CBOC being a community-based outpatient clinic, okay, so I can use CBOC for the rest of this talk. But seriously, that you're working, okay, with both parties that are in your service areas. And then finally, okay, we've got an ongoing working relationship with folks in the office within the Veterans Health, okay, that administer the network. You'll learn in a few minutes from Kelly that one of the things we're working on with Ward Circle Strategy is an update of the toolkit. Secondly, what's going on, okay, on the Hill and with the administration. Like health centers, services to veterans seem to be one of the few things that R's and D's can usually agree on. They want to provide the needed services and the resources to provide them. Everything's not hunky-dory and they don't agree on everything, but okay, in the end, there's usually a lot of collaboration, of the leadership in the House, the Senate, with the majority and minority party, and then with the White House. Something just, again, I don't know how far you have looked at the president's budget in this area, but, I'll mention 2 or 3 things that caught my attention. Okay, when I looked at the veterans portion of President Biden's submission for, the next fiscal year. First, okay, this is the highest aggregate amount ever requested for veterans programs. When you add them all together, okay, it's 10%, okay, above, okay, what was the funding in fiscal year 2022. There are some things that interested me and caught my attention. The continued interest, okay, in building up the VA's capacity to provide appropriate and needed health in the women's health area. Secondly, continuing to build, okay, the VA's capacity to deal with behavioral health issues. And then finally, a focus on homelessness, which in the case of the VA, part of their response is around housing. The other thing I think you can take from some of the initial reaction that the budget had when it went before a House Appropriations committee hearing recently. There are 2 things that stand out. Okay, one, there's a continued push and pull between what's the right balance between services provided within the 4 walls of a veterans facility and what should be provided in the community by providers. Okay, that's an ongoing debate. Okay, and it'll work its way out over the next few months. Okay, as the Congress comes to some agreement for 2023. The second thing, was the concern about the rising costs, of healthcare. Okay, and the fact, that a lot of the increase, the justification for the increases in the president's request were around rising costs. Now, I mentioned that only because that's something that health center advocates need to be aware of. As we put together our advocacy strategy, and as we show the value, of health centers, to elected officials going forward. Third area, okay, and Jennifer, I saw your name, okay, I hope you're well, okay, I haven't talked to you for a while, but I was thinking about, okay, some of you on this call today, our early conversations were around oral health. Well, maybe something's changing, okay, maybe it's getting closer, okay, to a point where some of the needs associated with veterans, okay, are going to be addressed. As I think all of you probably know, oral health is not a covered, okay, service or benefit for the vast majority of veterans. Only a veteran who enrolls in Veterans Health and who has a service-related condition that requires ongoing oral health services is eligible for covered care through the VA. So it leaves a large number of people, okay, who don't have access to coverage. So I'll give you 3 examples of things that are happening right now that say, well, maybe something's going to change. The American Institute of Dental Public Health, okay, is in the process of doing a very, very wide, broad survey, okay, about oral health needs in veterans. Okay, secondly, in the Senate, there's a piece of legislation. You see it on the slide, S3017, okay, which again would deal with dental care eligibility, for veterans. And then there's something called Vets Smile. You see it on the slide, uppercase, Vets, lowercase, mile. Within the Mission Act, okay, there was created in the VA an innovation office. They were given the authority to do pilot programs in a number of areas. One of them is around expanding access to veterans to oral health services. They are working on a program. It's a 5-year program. It goes by the acronym Vets Smile. They're starting small, okay, in a couple of states, New Jersey, New York, for example, but they're looking at others, and their ultimate goal is to have partnerships in all states before the end of the 5-year project period. The idea is to find dental schools, community providers like health centers, okay, who will work with the local, okay, VA VISN, okay, CBOC and or medical center, okay, to open up access to oral health services to veterans who otherwise would not have access to them. Stay tuned, okay, we're optimistic. Gene and I have had for the last 9 months, and there's Eva, okay, I see, who can speak, okay, about a real example, that and some real, Eva, we got, they were so happy when they were sharing numbers, okay, of people that are starting to come, but I'll let, Eva talk in a second. So anyway, let me just, Eva, let me do, the final point, and then we'll come back if you don't mind, if that's all right. Okay, great, thank you. My point beyond dental is that, okay, that there's a lot of things happening, and maybe we'll see progress. This is not going to be, okay, a one shot or a quick. It's going to be a longer journey. But okay, we're gonna certainly do what we can to support and work on this issue. The final thing I would mention then is, another provision of the Mission Act, which required that the VA look at its facilities relative to where the veteran population was, and ask the question, okay, where is there inadequate capacity? Okay, where is there adequate capacity? Where is there too much capacity? Not something that the people who come out of that in the non-winning category get real excited about. Those of you who followed the Department of Defense, okay, they have gone through what they call a base realignment, okay, committee that does, for military health, the raising of the question of when do you need to change, okay, a treatment facility within the DoD. This was a similar kind of charge to the VA. They created something called the AIR, the AIR Commission. They have issued their initial findings. about where they believe there are veteran facilities that need upgrades, improvements, where there are facilities that are no longer, appropriate. They've also identified facilities, okay, where they're not appropriate, but it's because the facility is in need of repair. That is generating a great deal of interest, and as I said, if you're a congressional person or if you're a veterans service, organization network, you're very excited, if the commission came back with a need, to expand or to add a CBOC or to, whatever. You're not very happy, if the results, of the survey, said that, you can be downsized or you can be transitioned to something else. It's the beginning of the process, but be aware, that if you have, facilities in your state, they may be impacted one way or the other, and you may hear about it. You may be pulled into it. We on the NAC end will continue to monitor, how the work of the commission goes and how the VA, implements it. So stay tuned. So those are the things that I was going to cover. And as I said, Eva, I know I asked you to wait, but if I can, Amy, I'm going to ask Eva maybe, okay.
Yes, indeed. Yes,
there you
indeed.
are.
And
There you
Eva,
are.
if you are ready, we've spotlit you here. So feel free to take yourself off mute and ask your question.
Sure. It's really not a question, more of a comment. As Dick knows, we're one of the original pilot projects for the Vet Smile program. The only point I want to make is that there's no money. So this pilot project, the legislation that enabled this pilot project was specific to say that it should be at no additional cost to either the VA or the vet. So they're building and having this pilot with entities that are able, through state or private funding, are able to do this for no extra money to the VA. So while we are happy to be working collaboratively, and we think there's a lot of good things, this is not necessarily a model that can be replicated broadly, or an answer to access to oral health services for veterans more generally.
Yep. Right. And again, my hope, is that what this demonstration, this pilot will do, is just produce more information and more reason for why this should be a covered benefit. So that's why the importance. There's going to be an evaluation component by virtue of it being a 5-year pilot, and hopefully it's going to continue just to add information that can be then used through advocacy efforts to make some changes down the road. So
Thank you, Dick. I want to see if anyone has any other questions for Dick before we move into a couple of quick polls and before our next briefing. Any other hands raised? I'll look for now. Yes, it looks like we have a question from, is it Latran?
Lathan. That's
Lathan,
correct.
yes, ma'am. So go ahead and ask your question.
And thank you, because I was trying to type it and I don't type that fast these days.
Sure.
This is my first time participating in this roundtable discussion, so I have no problems with Dick and Gina knows me, and they could say, Lathan, we'll take that offline. We talked about it. We've tried this before with working with our VA, who really wanted to partner, but only around oral health again. But one of the things that I want to ask, have you done this, is has there been any kind of survey or discussion with the veterans themselves as to are they willing to go somewhere else other than the VA? Because I did my own kind of survey, not statistically sound, but asking question, and what I got back, it just shocked me. So just wanted to know, you could be building something, but if they aren't interested in coming, they're not gonna come.
I'll start, Gina, and then you can, correct me or jump in. Okay, with Lathan, I'm not aware of a survey that's been done. I am very aware of anecdotally, people around. I'll just say in the health center world. Okay, people in the health center world. Okay, who have talked with veterans. Some cases, PCA directors like yourself. In other cases, health center staff with their patients. And the anecdotal feedback I get, is that especially the older veterans, appreciate the camaraderie, the comfort, even the VA medical center, even if you have to go and sit for 4 hours, and drive 2 hours. I mean, there's something there, but some of the younger veterans, say, we'd like to be able to get some of the basic preventive and primary care services, closer to where we live. Is that scientific? Absolutely not. But it's it's what I've heard from, again, health center peers around the country.
That's exactly what I heard, Dick, too. The older ones see it as a social club and talking about, we don't care if we sit there 4 hours. And their response to me was, we want oral health in our area here, and we want to be treated. They didn't use the word special, but, we served our country. Y'all need to respect that and do what we want to do. And just a quick anecdote, and I'll stop. We even thought about, hey, what if we build a separate entrance way to our health center, our clinic area, and say for veterans, you're going in the same place. I mean, that even excited them. But when we are talking about doing services, we've got to keep in mind what they want and what they would access. Just because we provide it, it doesn't mean that all of them will. But I did find it was an age difference in the answers I got. Thank you.
And Gina, you have some comments too?
Yeah, Lathan, thanks for that comment. And Dick, thanks for your response. I will say I'm familiar that the VA does do veteran preference surveys to ask the veterans enrolled in VA healthcare, where are the places that they access care? What is their insurance status, et cetera, et cetera. And so I think that this might be worth conversation with our partners at VA to see what they're collecting. Now, granted, it does not reach veterans who aren't enrolled at VA, who don't get the survey, or veterans enrolled at VA who don't answer the survey, but it's a start. It's a good question. I think also the concept of military cultural competency, we really do need to lift that up. And, that's something that the VA does so well. And there is a specialness to that at VA facilities. I think VA can't be everywhere. They have the community-based outpatient clinics, which Dick mentioned. I think it remains to be seen what happens from this new assessment of facilities, and how that does or doesn't influence the expansion of other community-based care and services, either provided by VA solely or in partnership with entities like community health centers. So I really appreciate that point. And I think for the sake of time, although, gosh, we could spend the whole hour just talking about this, I do want to transition. Amy, I know you have a poll question. And if you could introduce that poll question, I'm going to make one other comment.
Absolutely. Thank you, Gina. Yes, folks, we have 2 polls coming up, and my apologies, it's a little bit of noise in my background here. Hopefully you can hear me just fine. First poll here, everybody look out for it. Should be coming up in just a second here. The question that you should see is, have you used NACHC veteran health focused resources? Just a really basic question here, yes or no? And then after we publish and show you the results here, we're going to have a follow-up on this question. So just one moment as we finish this series. It looks like we have 33 people that have responded so far. So if those of you looking for your polling function, look to see if you have a little red dot popping up somewhere. You should see a question here for you to answer about whether or not you use NAC's veteran health focused resources. I'm going to wait just a couple more minutes, well, seconds, frankly, probably 20. Let's see here. Got 37 responses. Okay, looks like it's down to an end here, and let's share the results. Okay, we're going to go with no. So this is actually very, very, very helpful. So let's ask the follow-up question. Here we go. Question 2 coming up. There we go. Which veteran resources have been most helpful to you? Now that's those of you who have used the resources, of course, and now we're in a different subset perhaps, but if there's anything here that you have used that is particularly helpful, I'd like to know.
And Amy, this is Kelly. I would just chime in to say, based on the answer to the first question, this one is probably not relevant for a lot of folks if you aren't familiar, but it tees us up for our next session. So after you get some responses here, we'll share and Gina can make a couple of comments.
Yeah, so just I'm going to wait another few seconds here, 20 seconds.
So Kelly, oh, Amy, are you ready to show us?
We've got some people still responding. So let me just see here. We are just about done. And let's go ahead and share these results. And then you can evaluate these. And I know you have an announcement. So yes.
Well,
looks like education session. So go ahead, Gina.
Yeah, as Kelly mentioned, I think these responses show the importance of the segment we're going to next, where Kelly is going to preview for you all some of our technical assistance tools and products that we're developing over the next few months, and to find out if it's valuable for you or how to get the word out about it. Some of these products that we're about to talk with you about are only possible because of NAC's partnership and communication with officials at the Veterans Health Administration and the VA. And so I really want to thank Dr. David Shulkin, the former Secretary of the VA and Undersecretary of Health, for always promoting partnership with community providers like FQHCs. His leadership message had always been, let's get veterans the right care at the right time, at the right place. And I wanted to thank Dr. Shulkin for being here today. So with that, back to you, Kelly.
Great. Thank you, Gina. And thank you, Amy, for sharing the information on the polls. I'm just going to spend a very quick minute describing some of the things that we are working on and to give you a preview of what to expect in the coming months. Several of the products that we're working on actually exist already and are products that we had developed in collaboration with NAC and several folks at the Department of Veterans Affairs and in the Veterans Health Administration, really sort of in the 2018-2019 timeframe. So it's been a few years since several of these products have been updated. The first item here, Community Care Network Toolkit and Fact Sheet updates. These are really, I would say, kind of glossy one-pagers. So the fact sheet is a one-pager and the toolkit is a little bit more in depth, but goes into detail, really sort of describing how a health center can engage the VA and get started in becoming a participant in the community care network, what resources are available, how to find more information, from VAs, contracted partners as well. So these products are available now. If you were to go and find them, they will be updated later this summer. So keep an eye out for that. Several of you said that you had used or reviewed the health center success stories. Also, I think it was probably 2019, we had the opportunity to really get to know about 10 health centers and do a little bit of a deep dive into some of the great work that they were doing to support veterans in their communities, whether it was through specific programs like providing dental services, veteran hiring efforts, or really just engaging with their local veteran nonprofits and veteran service officers to encourage veterans to seek out care in health centers. So we are updating those 10 success stories, and we're adding a few more. I think a few of you who we've been in touch with are actually on this call. So thank you in advance for your time and the additional information that you're sharing with us. What we really hope these success stories will do is really sort of provide other health centers with ideas about ways they can engage with veterans and with veteran serving organizations in their communities. Our third item here is what we're calling data analyses, and it's a pretty broad term, but those of you who were part of the initial Veterans Interest Group when it stood up may recall we worked very closely with VA to develop some cool looking maps that overlaid veteran populations with the locations of FQHCs across the country. This was really as the Veteran Choice Program was getting stood up, and we were trying to figure out where there may be opportunities for health centers to do some proactive outreach to veterans that may be facing long wait times in VA facilities and access to care. So our primary effort here is to really see if we can update some of that work, see if there's other data that would be useful for health centers that are looking to find veterans, are looking to find information about the veteran community in their local markets. So this is certainly an area, if folks have ideas about, information that would be helpful for you to know, we are all ears and certainly would love to get some suggestions and ideas. Fourth on our list, supporting veteran hiring and employment. As Gina had mentioned, one of the things that I think we've seen great success with, health centers that have made a focused effort on increasing their sort of military cultural competency with the delivery of healthcare. So that's one example of, the type of support and resource we want to make sure health centers are aware of and have access to. But, in our current labor market, we know everybody is looking to hire, talent and great talent, and veterans tend to be at the top of that list in terms of employees that are dedicated, mission focused, and can make great contributions to health centers. So we'll be re-upping some of the tools and resources that are available to health centers that are specifically interested in finding veterans to hire and bring into your health center as employees. And let's see, finally on the list here, we will be doing another office hour, probably sometime in June, specifically focused on the Vet Smiles program. It will be targeted for those health centers that have participated in it, so we can discuss lessons learned and best practices. There'll be more information about that coming out in the next couple of weeks over email as well for others who are interested. So just a very quick highlight of some of the products and tools. All of this information, when it's ready, will be published on the NAC website. You'll probably get lots of emails with links to where to find that information. And so I will pause there. Dick, I see that you've got a comment, and I think we may have some comments in chat too. So Dick, why don't you go ahead?
Actually, I was responding to one of the questions from Olivia in Montana. And Gina, I don't know if you saw her question was about asking, okay, at the front desk or through the visit process, veteran status. And again, Olivia, we did publish the results of some work that folks in Iowa did. It's a partnership with folks at the Iowa PCA, one of the health centers in Iowa, and then the VA Research Center, where they really did a deep dive, okay, on asking the question the best way possible. So that's readily available. But Gina, I'm not aware if there's been any updating of that information recently.
Yeah, thanks, Dick. There's actually been a toolkit on how to implement that screening question, including integrating the hard stop into the practice management system at the health center. And I believe the Iowa PCA uploaded that just in the last year to the Health Center Resource Clearinghouse. So I'm going to look for it now and pop it in chat while the conversation continues.
Great. And folks, we're open for any other questions for Kelly here too. If anyone else would like to raise their hand at this time, or
Now, it looks like there is another question in
chat.
chat from Lathrun. Yep. Was the letter of encouraging partnership from Dr. Shulkin shared with the PCAs and health centers? Leadership at 2 local VAs were very positive about working together, but when turned over to staff, everything fell apart. Oral health was the only thing that staff wanted to talk about. I think that is certainly, and Gina and Dick, you can back me up here. One thing we have heard over the years is one of the challenges is, as staff turnover in the VA, it's really, frustrating when you have to reestablish those relationships, with people and really sort of sell the health center back to the VA after all that work had been done. Certainly I think this is something as, NAC continues to develop and reestablish relationships with VA. There's some new leadership coming into the community care program as well. A major area of focus for us at the national level. And certainly I think there is opportunity to, kind of share some of that information and some of those conversations that are happening in DC into the VISNs and down to the local VA facilities as well, so that they know that this is an important partnership.
Thank you, Kelly. And it looks like Gina has also posted for everybody the initial screening effort from Iowa.
Can I follow up with
yeah.
what you said? Because my real question, I shouldn't have put all that in there. Whomever was talking about, I think it may have been Gina, that Dr. Shulkin had written a letter encouraging that participation with the VAs and the FQHCs. And what I was asking for, I'm sure the letter was sent to the VAs. What about getting us a copy? Because me having a copy of that can say, hey, you're being encouraged to do this. I actually have a document. And so that's what I was asking, was that letter, I'm not sure how long ago that was that shared with anyone else other than VAs, or was it?
Understood.
Okay,
Understood,
it wasn't
Liz.
a letter, it was just a message or speech. Okay, thank you.
So, I mean, yeah, Dr. Shulkin, okay, spoke, okay, and now I'm going to not, remember, it was at least 4 or 5 years ago at a Washington NAC Policy and Issues Forum, and this was a major part of his presentation, the partnership idea. But golly, I cannot remember. But I mean, it was definitely, it was pre-pandemic. Okay, I mean, it was back, I would imagine it was 16 or 17. That was probably the year, I'm going to guess.
Okay, great, folks. Thank you. I think we have a couple things. I think we actually want to encourage engagement in our last 11 minutes here together. And so we're going to skip a couple of the polling questions. I actually think you guys are sort of talking about one of them right now, actually, to be honest, the screening question. So we want to make sure that we get a chance for you all to engage more so than just through the poll. So let's move in to that. We're just going to open up with a couple of prompts, and this is really, truly, we're going to pause and wait for you all to offer any thoughts, feedback, or responses with your hands raised or in chat. So one of the first things we wanted to offer as a point of conversation is a question about what's worked for you all in your communities with respect to connecting with veterans in your area. We know that finding the veterans is just this constant challenge. So what has worked for folks to connect with veterans in your area? Please, if anyone would like to share best practice or some ideas or something that in particular has worked, this would be great. Please raise your hand and feel free to offer. It doesn't have to be long. Just throw some ideas out or in the chat, please. Anybody with some, I know this is a challenge. It just shows you that it is a challenge. And there's obviously no silver bullet, but anybody have any particular strategies they'd like to offer? Sure. How about Ava? Eva?
Yeah, it's Eva.
Thank you.
So just one thing, I think the comment that was made before about personal relationships is a two-sided sword, right? On the one hand, we found great benefit and effectiveness with having relationships with the folks that were running the local medical systems, and particularly the CBOCs. But when they retired or left for whatever reason, we were out there with nothing, which is why we like the Vet Smile program, where the referrals are official, coming from the VA itself, and then everybody knows they have to be on board. We have been identified as a trusted provider of services. The other thing that did work for us, which was through personal connections, was we would drive our dental van to the CBOC. And station it there, and then the folks at the CBOC allowed us to have a little registration table inside that facility. So to the veterans, it looked like a seamless system of care, and that really worked out well for us. But once again, we're looking for a system that actually might pay us some money and make us an official provider.
Oh, thank you very much. It looks like we have another hand raised, and forgive me, I'm not sure your name. It looks like we've got a little bit of an acronym, but go ahead and take yourself off mute. It looks like Hodge, S. Hodge.
Yeah, good afternoon, everyone. This is Sharon Hodge, Vietnam Veterans of America, and this is my first session, so it's a lot of good information. And I was going to mention transportation was an issue for the dental, but now I found out that you do have dental vans that go to the different CBOCs, but unfortunately, just like you say, funding is an issue, and I'm not sure why the Mission Act would put a pilot program in for 5 years without any funding. It's like, really? It's congressional intent to reach the veterans, and a lot of our veterans are older veterans, so we're looking more at transportation as an issue. In particular, our veterans in rural area, which are 65 years and older, and they do have a tendency they have a tendency to isolate themselves. And isolation means lack of medical care. It means lack of personal contact. So we are trying to work with our older veterans to find out what are their basic needs. And the basic needs would be have access to medical care locally and access to transportation. And we do have telehealth and telemedicine, but a lot of them are suffering with broadband issues. So that was one of my top reasons for responding to the question.
Thank you very much. Gina or Dick, any follow-up on that? Okay. Other folks with either tactics that have worked or suggestions for reaching veterans in their communities. Okay, let's talk about something that maybe even a little bit more on the tip of your tongue, which is about challenges. So what challenges are you facing working with your VHA counterparts? So what kinds of things are difficult to navigate, whether it's certain types of responsiveness or perhaps bureaucracy, authorizations for care, anything like that? What are the primary challenges that you've had working with your VHA counterparts? It looks like I have Linda. Would you like to take yourself off mute and ask your question or give your comment?
Thank you very much. Linda Maxson, Coast Community Health Center along the Oregon coast. We have a Veterans Administration large facility in Roseburg, Oregon, which is less than an hour from our location. We've had multiple attempts to have the director, which has transitioned over the 10 years I've been with our center, come and visit our center. We have another veterans small medical center 30 minutes south, and then another center 30 minutes south from another clinic. We're getting pushback in terms of not wanting the veterans to attend our facility and rather have the veterans go directly to their medical facilities. However, their medical facilities are really challenged by having continuity of staff. And I just would like to open it up to any suggestions in establishing a relationship and And is there formal contracts or agreements that could be made so that we can get the services to our veterans who really want to be seen at our health center? I hope that is a accurate enough question to get some feedback on. Thank you.
Yeah, absolutely. Thank you, Linda. Does anyone have any conversation for Linda on this topic? Gina, yes.
Linda, you probably already know what I'm going to say. Okay, but I just want to make sure. I mean, the interesting thing about the community care network, okay, it by definition requires, okay, that there is that established agreement. So like I said earlier, they don't call them preferred provider networks, but that's, in my mind, that's what they are. Okay, but there is an agreement, and then the third-party administrator, in your case, TriWest, okay, would also have that, because the veteran, okay, is then able, through the Office of Care Coordination at that veteran medical center, they're able to actually request, okay, that there be, okay, a visit in the community. Okay, and it has to be an established, okay, network provider. Okay, so, but.
And Dick, I would just add for Linda's consideration is there are others on this call, and I see Fred Jackson from Wayne Memorial has his hand up, who have found different ways to establish that relationship, not only through the way that Dick is suggesting, but others. So maybe we even do some exchange across email. I know we're getting close to time, but if anyone has, kind of casework that you want to follow up on in your locality, please reach to Dick and I and the team. But if we could hear from Mr. Jackson, Amy, if we have 1 minute, he's been working with VA for a while, I believe.
Fantastic. Yes. Fred, would you like to chime in here, please?
Yeah, we are actually a contracted CBOC for the VA. We have been since about 2015. It's challenging working with them, the bureaucracy and some of the intransigence in the VA. But we have about 1,000 veterans enrolled in our CBOC, and it works pretty well overall. I mean, we don't make money on it, but we don't lose money either. So it was very political getting there. The local VA did not want to do it. And I see with this 10-year plan that they're rolling out, I think that we talked about before, that there may be some consolidations. I know they have the Wilkes-Barre, Pennsylvania VA, which we contract out of, has indicated that they have 3 private CBOCs that they contract with, and that seem to be, and this plan came out of Washington, I think not really out of Wilkes-Barre, that there would be a contraction of the private CBOCs. But so we'll see what happens.
Thank you, Mr. Jackson. And in this absolute spirit of time, I just want to say that we've had both Linda and Gina offer some ideas here in chat, and Linda's email for any ideas that come through, success at that. Frankly, I think we could have extended this at least another 15 minutes to a half hour. So folks, we are at our end, but we have a couple things we do want to ask before you go. So if we can move to the next slide here. Gina, we're going to do a closing. We're going to submit, so don't click off until you receive a evaluation survey in the chat. We'd really, really appreciate if you all spend a couple minutes telling us how this meeting went. We want to make it better and better and more suited to your needs. The other thing is we have one more poll, and Gina, with your approval, can I go ahead and run it? All right, I'm going to run one last poll here, and this is about whether or not you may find value in going to an in-person gathering in August in Chicago for more engagement. And Gina, if there's anything else that you want to say on top of this as people are filling out the poll.
I just want to thank folks for their time, and please give us your feedback if you want something like this again. We're happy to bring folks together. This was our first. Really appreciate all the discussion. Put it in the survey, email us, whatever works for you. Amy, thank you so much for your facilitation today. Is there anything I'm missing?
I don't think so, Gina. I do think, go ahead, folks. We want to make sure my team has put the evaluation survey in chat. So look for that before you click out, and please fill out this quick Zoom poll as well about the Chicago gathering, but hopefully you can complete the survey. Let me make sure it is out. See, yes, Anjali. So look for Anjali Morgan. Anjali Morgan, Ward Circle Strategies, has posted a link. That's your link to the evaluation survey, and we want to make these better and better now with the realities of Zoom. We want to bring this to you in the best way possible. So go ahead and look in the chat and click on Anjali's link there, and let me end this poll here. We've got 25 responses, and looks like there may be some value in the Chicago engagement. So thank you all very much. Anybody closing? Any other closing remarks? All good. All right. Thank you all very much for being here. And we will have this recorded and posted on the NAC website. And feel free to be in touch, like Gina said, anytime. So thank you all, and enjoy the rest of your day.
Thank you, everyone. Be well.